Good afternoon. The committee will come to order. I want to welcome our witnesses. I also ask unanimous consent that Representative Scott sit at the dais and be recognized for questions. Hearing no objection, we will proceed. When I came to Congress to work for the people of Virginia's 2nd District, I knew there were many issues covering a range of topics I wanted to solve. What I did not expect was the sheer number of VA-related issues. Since beginning my first term nearly 2 years ago, these issues are the most common complaints people call my office about. And through my work as chairwoman of the Oversight Subcommittee, I see why. As chairwoman, I have unfortunately discovered many cases of poor leadership, gross mismanagement, and substandard medical care at VA facilities. Sadly, this includes my veteran community's local facility, the Hampton VA Medical Center. In March 2024, my district office in Virginia Beach began to hear concerning reports from whistleblowers about the Hampton VA, particularly the facility's leadership and surgical services department. Whistleblowers described the facility as a repository for well-founded patient safety issues and hostile work environment complaints. Whistleblowers also alleged physicians who spoke out on behalf of veterans and quality care were retaliated against. After hearing this, I immediately began investigating these shocking allegations. Since then, my team has talked with numerous whistleblowers to fully understand Hampton VA's many issues. Through this work, I repeatedly heard reports of patient safety concerns, ineffective facility leadership, internal employee disputes, and dirty surgical operating rooms. For example, I heard reports that clinical staff were forced to clean surgical rooms themselves if they want to treat their patients in a sanitary environment. I also heard facility leadership consistently failed to address patient care concerns. And as a nurse practitioner, these allegations were very appalling. Whistleblowers reported how instead of investigating the patient care concerns that were brought forward, VA leadership would retaliate against those who reported the concerns. Whistleblowers alleged that because of this environment, the Hampton VA has a critically low number of clinical staff. For example, the Hampton VA has only one full-time anesthesiologist. This significantly limits the number of surgeries at the facility, which forces patients needing emergency care to be transferred to other facilities. As a nurse practitioner, I know moving patients around in this fashion raises the risk of complications and harm, and this is unacceptable. The VA Office of Inspector General has released several reports on the Hampton VA which confirm the facility had serious issues. I was alarmed when Inspector General Massal told the committee during a hearing earlier in the month that Hampton VA leadership did not follow basic processes and that VISN 6 did not even know there were issues with the Hampton VA leadership. Such lack of oversight is especially alarming given the OIG has published multiple reports beginning in 2022 detailing Hampton VA's leadership failures. As such, VISN leaders should have been aware there were problems at the Hampton that needed fixing. Moving forward, VISN and Hampton VA leaders must regain veteran trust. Now, I'm aware Hampton VA has new leadership, and I'm optimistic that if these new leaders fully implement the OIG's many recommendations and if VISN 6 properly conducts oversight, the Hampton VA can move in the right direction. I will continue to work with the VA to make sure this happens. House Republicans have continued to put the VA's feet to the fire to fix these problems at VA facilities nationwide. These leadership changes were desperately needed at Hampton, and they were exactly what we are talking about when we tell the Biden-Harris administration that concrete actions need to be taken on behalf of veterans and their families. I look forward to speaking with our witnesses today to learn more about what the Hampton VA and VISN 6 leaders are doing to address the OIG's recommendations and whistleblowers' concerns. With that, I now recognize Ranking Member Mervan for his opening comments.
Thank you, Chair Kiggins. I appreciate the opportunity to discuss the Hampton VA Medical Center. To start, I want to acknowledge the hardworking and passionate staff down at the Hampton VAMC. My subcommittee staff visited the facility last month and has impressed upon me the staff's drive for serving veterans. It has been a difficult several years for staff at Hampton. They have all been working hard to fill the gaps and to address the many challenges the facility has faced. To those employees, we hear you, and your efforts have not gone unnoticed. As a community with one of the fastest growing veteran populations in the country, Hampton is the perfect place for VA to put its best foot forward. Hampton brings together a vibrant military community with thriving veteran population and has leveraged many opportunities for collaboration between the Department of Defense and VA. In fact, for many years, Hampton was one of the best images for VA success, particularly regarding their police staffing models and the innovations in healthcare. However, I recognize that this has changed. Recent reports from the OIG and the staff demonstrate that there have been very real challenges and concerns about the care and culture there. Hampton has not been immune to the nationwide clinical staffing shortage and the strain that COVID-19 pandemic placed on many VA facilities. The facility has also been plagued by frequent leadership changes. This has led to breakdowns in the implementation of key policies and directives and has contributed to a degrading and uncollaborative workplace culture. This culture has directly affected patient safety. Further, confusion about the roles and the responsibilities of VISN has impacted the facility's ability to address long-standing and compounding issues like staffing and resource management. For the last several months, my staff has heard from several Hampton clinicians and staff about their concerns. Many of these concerns note challenges and lack of follow-through with their peer review and joint patient safety report processes. Hampton leadership is reportedly updating these policies to create better trust and transparencies in these systems to promote a culture of safety. Other reports alleged degraded supply chain and environmental management practices. Over the past year and a half, leadership in these services have improved staffing and implemented new standards to address these concerns. However, there is more work to be done. I appreciate the work that the Inspector General and the Office of the Medical Inspector have taken on to identify key challenges with workplace culture, surgical and oncology operations, supply chain efforts, and the credentialing and privileging process at Hampton. Despite these challenges, we see the new leadership, represented by Mr. Dannenberg, here today, striving to make changes. While there are certainly still places for improvement here, I look forward to working with Chair Kiggins and the VHA, VISN, and Hampton leadership to address these issues and recommendations. It is clear that the culture change is badly needed at Hampton. This change will not happen overnight, and I remain committed to providing productive oversight and supporting the changes taking place. I thank the dedicated VA staff who remain committed to providing care at Hampton area veterans. Thank you, and I yield back.
Thank you, Ranking Member Mervan. We will now turn to witness testimony. Testifying before us today, we have Mr. Paul Cruz, the VISN 6th Director, Mr. Walt Dannenberg, the Hampton VA Acting Executive Director, Dr. Frederick Kotler, Interim Medical Inspector in the Office of the Medical Inspector, and Dr. Jennifer Baptiste, the Deputy Assistant Inspector General for Healthcare Inspections in the Office of Inspector General. Will the witnesses please stand and raise their right hand? Do you solemnly swear the testimony you are about to provide is the truth, the whole truth, and nothing but the truth? Thank you. Let the record reflect the witnesses answered in the affirmative. Mr. Cruz, you are now recognized for 5 minutes to provide your testimony.
Good afternoon, Chairwoman Kiggins, Ranking Member Mervan, and members of the subcommittee. I appreciate the opportunity to discuss Hampton VA Medical Center. I'm accompanied today by Dr. Rick Kotler, Medical Inspector, Office of the Medical Inspector, and Mr. Walt Dannenberg, Acting Medical Center Director, Hampton VA Medical Center. As a Navy veteran who receives care from the VA, providing outstanding care that improves the health and well-being of our veterans is deeply personal to me. My 30-year career in healthcare in the private sector and VA has focused on quality, patient safety, and patient-centered care. And I remain committed to these priorities for the 584,000 veterans we serve across North Carolina and Virginia. My journey began as a young Navy corpsman who, newly separated, faced excruciating leg pain during my first appointment at the VA. My initial experience was discouraging and left me feeling disheartened. However, a later visit to a different facility restored my faith in the system through the compassionate care I received as I joined a rare group of amputees. This experience ignited my passion for healthcare leadership, motivating me to ensure that every veteran receives the care that I was fortunate to find at my second VA Medical Center. Today, VA has evolved significantly since my first encounter 30 years ago. Even so, medical errors remain a major risk in healthcare. My leadership team and I strive to reduce and minimize avoidable harm by focusing on process improvement rather than individual blame. When we find areas for improvement, we address them and actively engage our staff in those improvement efforts. Since I arrived in late 2021, I have actively engaged my leadership team, program officials, and medical center leaders. We interact with our 7 healthcare facilities, leaders, and staff frequently through planned and for-cause audits and oversight visits. During fiscal year 23 through fiscal year 24, we have completed over 265 oversight visits face-to-face, VISN-wide, and 38 for Hampton alone. When issues are identified requiring action, we provide the oversight necessary to improve the quality and patient safety. Effective communication is crucial for preventing errors, enhancing patient safety, and protecting patients from preventable harm. I commend all of Hampton's employees for communicating and reporting safety concerns. Our staff's commitment to reporting these challenges and our collective dedication to addressing them are vital for our organization's improvement. Between 2021 and 2022, various staff reported 3 major safety concerns to the OIG, underscoring the need for vigilance. These reports led to important and serious recommendations, which have my full support and attention. I'm pleased to share that all recommendations from the 2022 report have been implemented, and the report has been closed. Additionally, all recommendations from the 2023 report have been implemented, and the request for closure was recently submitted to the OIG. The 2024 report contained 12 recommendations that are actively being addressed. Status updates will be sent to the OIG as requested. I want to acknowledge the dedication of our facilities teams and leaders for their hard work in navigating these challenges. Their commitment to our veterans and employees is invaluable, and I am confident we will continue working on these concerns until we prove sustainability. As you know, there have been recent changes in leadership at the facility. The medical center director is currently detailed pending an internal review, and the chief of surgery has returned to a staff surgeon position. Tragically, after stepping down from his position, our former chief of staff, Dr. Sean Alexander, passed away unexpectedly last month. He was a beloved colleague, and my deepest condolences go out to his family and the entire Hampton VA team. My team and I continue to take these reports and recommendations seriously, implementing consistent actions aligned with policy to strengthen the care we provide to our veterans. Madam Chair, Ranking Member, thank you again for the opportunity to join you for this important discussion. My colleagues and I look forward to addressing your questions.
Thank you, Mr. Cruz. Dr. Baptiste, you are now recognized for 5 minutes to provide your testimony.
Chairwoman Kiggins, Ranking Member Mervan, and subcommittee members, thank you for the opportunity to discuss the Office of Inspector General's oversight of the Hampton VA. The OIG recognizes the commitment of frontline staff at the Hampton VA, and we encourage the facility's acting leadership to continue to focus their efforts on creating a culture of safety and accountability and supporting staff in their mission to provide high-quality medical care to veterans. Over the past 3 years, the OIG has published several reports highlighting serious deficiencies at the Hampton VA. My written statement provides the details of these inspections that substantiated a range of allegations related to inadequate clinical care and revealed that leaders lacked a basic understanding of the quality assurance processes that support the delivery of safe health care. The first 2 reports highlight failures of communication and care coordination by multiple providers, resulting in delays in the diagnosis and medical care of 2 veterans, one with prostate cancer, the other with lung cancer. Significantly, our team uncovered that the facility lacked required elements of a comprehensive cancer care program, namely a cancer care committee, a tumor board, and a cancer registrar. Leaders passed these deficiencies off as a mere oversight, but the lack of these essential structural elements of a cancer care program reflected disengaged leadership that was not attentive to required services. The third report details significant mismanagement of the processes that are fundamental to an effective patient safety program. The facility made numerous errors when conducting reviews of alleged poor surgical outcomes for veterans under the care of the Assistant Chief of Surgery. The clinical care reviews were not conducted according to policy to ensure accuracy and fairness, and were not reported back to the Medical Executive Committee that has responsibility to make recommendations on privileging actions. When the Hampton leaders attempted to revoke certain surgical capabilities, incorrect processes were followed, and ultimately this resulted in all attempts at privileging actions being rescinded, as well as a year-long delay in reporting the provider to the state licensing board. It is worth noting that we have seen similar failures of patient safety and quality assurance processes at other VHA facilities. Our reviews of Hampton, as well as our reports at multiple other VHA medical centers, highlight the impact of passive oversight by VISN leaders and staff. While facility leaders are expected to reach out to their VISN for support when they determine a need, the current structure does not mandate a proactive role for VISNs in supporting medical centers. The OIG has intensified its focus on VISN leaders' roles and actions in supporting facility leaders and staff, as reflected in our testimony before the Subcommittee on Health in June of this year. To make the needed progress, VHA must ensure its vast resources are proactively deployed to support underperforming facilities and that they're following the policies and processes that guide the delivery of healthcare to veterans. We recognize that VHA has recently made changes to Hampton's leadership team and that their efforts to improve the culture and operations of the facility will take time. Meaningful improvements will require the full engagement of effective leaders as well as the proactive support of the VISN. Congressional hearings such as this help to bring attention to issues not only at Hampton, but the VA system as a whole, and serve to rebuild the trust of veterans and staff and hold leaders accountable to their mission. While the Hampton facility has taken steps to address identified problems, the OIG will continue to monitor progress at Hampton as well as other VHA facilities to help ensure staff are supported and that veterans receive the timely, quality care they deserve. Chairwoman Kiggins, Ranking Member Mervan, and members of the subcommittee, this concludes my statement. I would be happy to answer any questions you may have.
Thank you, Dr. Baptiste. We will now move to questions, and I yield myself 5 minutes. Let's see, for Dr. Baptiste, for each of the last 3 years, the OIG has published reports that were critical of the Hampton VA's clinical care. Were there any common themes in these reports?
So there were a number of themes throughout these reports. First, a lack of care coordination, a lack of communication of test results to veterans, leadership that was either disengaged or lacked awareness of these fundamental quality review processes that are essential to ensuring patient safety. We also found deficiencies in the process by which the facility conducts institutional disclosures, so there were some critical elements missing from the information that was shared with veterans or their family members. Again, just the failures of leadership to really ensure a culture of safety at the facility. That's critical that frontline staff know how to enter patient safety reports and that they feel empowered and safe to report those incidents of patient safety.
Thank you. And Dr. Baptiste, again, the OIG's July 2024 report highlighted that Hampton's leaders lacked a, quote, basic understanding of the processes that support delivery of safe health care. Can you describe what you meant by this?
Prioritizing patient safety is critical for any hospital. So first, ensuring staff know how to enter those patient safety reports and that they're empowered to do so is important, and we found that that was lacking. Additionally, facility leaders did not ensure that these patient safety reviews were conducted according to VHA guidance and processes. When those patient safety reviews are not conducted appropriately, then a facility can't learn from their mistakes to improve patient safety and prevent future harm to patients.
And in your report, did you find that VISN 6 leaders knew about these issues with Hampton's leadership?
In our first 2 reviews, we did not focus that review on the VISN. It was really focused on those individual patients and the care that they received at the facility. In our 3rd review, we did review some aspects of the VISN's involvement in terms of how those patient safety reviews were being conducted. The VISN has some role in that process. Our concern would be that, in 3 years, we had 3 reports at the facility, so we would expect that the VISN would have awareness that there were concerns at the facility and would take a proactive role in either supporting the facility or directing change.
So and along those lines, how could the VISN 6 officials have done a better job conducting oversight of Hampton and its leaders?
Having that awareness of our reviews, our ongoing reviews, the open recommendations, taking a more proactive role in the facility and ensuring that facility leaders are aware of and conduct all the required processes according to VA policy.
And also, just for the record, do you feel like any of the care coordination, patient safety issues were the result of staffing that's inadequate? Maybe our providers are, I know when I visited, I felt like there was a large patient load that they each carry, so that they are perhaps overworked. I know there's electronic charting, still we haven't implemented the newest, latest and greatest, so as far as charting, inadequate charting, and then which also is connected to the communication with patients being able to access their records. How much of those patient safety issues were related to, I guess, those types of kind of, more tangible things like staffing or charting?
We didn't review the adequacy of staffing in those first 2 reports that were really, again, focused on those individual patients with cancer and their coordination of care. Coordination of care is certainly critical. I'm a primary care physician as well, and so that's a really something that's very near and dear to my heart in terms of ensuring quality of care coordination. And we certainly recognize that frontline staff need the support and time to conduct all of those care coordination roles.
I'm sure those things play a role as well. And then to Mr. Cruz, the OIG's 2024 report found that the VISN 6 did a poor job of managing the facility. Do you agree with the OIG's conclusion?
So thank you, ma'am. First off, I think it's important that we understand that the OIG is a partner of ours to help us look through these situations, and we have a lot of engagement with them. As soon as we became aware of the information that got to the OIG, that we became aware of that, we were very active in looking at the processes and being engaged with our facility. In my opening statement, I talked about the increased number of oversight visits that we conducted, where my chief medical officer team as well as quality team were actively engaged, spent many days with the facility looking through their processes and helping coach them through the corrective actions. We found many ineffective, inefficient, and inconsistent processes, and those are things that we have to address to make sure that we can do what we believe is, and my main mission is to provide the highest quality care that we can to our veterans.
And who within VISN 6 is responsible for engaging with facilities like Hampton?
So ultimately, it's my responsibility to make sure that we are engaged with our facilities. And to do that, my team is, and since I've been there in 2021, I have been ensuring that we have structures at our VISN that allow us to take an active stance, establishing risk registries and different functions that we can ensure that we're aware and that we follow through with issues, and that our teams are going out, visiting these sites, learning what's going wrong, coaching the staff where there may be some inefficient or ineffective processes, and then driving corrective actions. And then we come back and talk about those once the team comes back to make sure that we're not having issues across any of our other facilities to make sure we can learn from these inefficiencies.
So you said that ultimately the responsibility was yours for oversight with your facilities like Hampton. So how many times would you say a year that you visit Hampton VA Medical Facility?
Yearly? I'm sorry, I just...
Yearly.
Yearly. I visit the Hampton site as often as I can. Many times on my way back from DC, where I spend a lot of time, I also stop in at Richmond and at Hampton. I think I was just there last week. I've been there a number of times. I'm sorry, I can't recount off the top of my head, but I frequently have been there. I also do a lot of teleconferences with the leadership team. We also have systems in place to do operations reviews with each of our facilities every month, so we can discuss current issues. And I speak with the medical center directors on a weekly basis. And then my team reviews our hot issues on a weekly basis to make sure that we're following through and that we keep an eye on everything, all the action plans and so forth.
So what do you think is the main reason then that Vision 6 was unaware of the issues that the OIG identified, some of which the OIG had identified previously in 22 as well?
So I believe we were aware and had been, when the OIG, let me correct myself, when the OIG sent that forward, the message came through, I'm not sure, I think it was from an internal source that went up to the OIG. We engaged immediately with the facility as soon as the OIG notified us of what had been reported. And we worked through looking at those inconsistencies. Healthcare, as you know, is a very complex system, and a lot of times the oncology services can be even more complex. So we do our best to stay on top of these processes and looking at all of our different clinical service lines. We knew that there were some inconsistencies in making sure that our policies and processes were in place. And for that reason, we had teams that are out there visiting them.
And I'll just say that time and time again, hearing complaints to my office from, and I think we interviewed a total of 25 or so whistleblowers, and so it wasn't a new problem. These are issues that had been sometimes years, in effect. So there was some sort of disconnect, and I think that's what we're trying to get to the bottom of, and hopefully the OIG report and then our hearing today, so that we don't have that problem going into the future. But I will yield to Ranking Member Merban for questions.
My subcommittee staff visited the Hampton VAMC late last month. As you highlighted in your testimony, this facility has faced several challenges over the past few years. I'm glad to see that the VA's interim leadership has taken steps to improve policies and procedures and address other shortfalls. During this visit, committee staff heard from several leaders within the VINZ 6 about the work they have been doing to assess Hampton's challenges and support the facility's growth. Mr. Cruz, what is the role of the VISN in monitoring trends and data like joint patient safety reports or harassment complaints? And how does the VISN intervene when troubling trends are identified?
Thank you. Excuse me. Thank you, sir. Our role in our oversight is that anytime we either identify some type of an anomaly in data or some report, as a matter of fact, we look at every patient safety report that comes in on a daily basis, a Monday through Friday basis, to identify trends and patterns and concerning things that we may see. When we find a signal, our team assembles and looks at what has actually happened by going back through and looking and doing a care review and engaging where we find ineffective or inefficient or improper being care or care coordination being delivered. And then we work to coach those teams to make sure that their policies are in place and set to make sure that we have sustainable processes.
You had mentioned, I just have to follow up with something. You had mentioned the complexities of the oncology process. Can you educate me what those complexities are that you've identified and how we can make them possibly simpler, since that is a life-threatening disease?
Yes, sir, I'll do my best. I'm been around healthcare for 30 years, but I'm not a physician. However, I think it is very important in complex care situations, and oncology is not the only one, but it is itself very complex, that we make sure, and we have in this instance, establish cancer navigators, folks who can lead the patient through their care and therapy regime.
Does the Hampton have those?
Yes, the Hampton.
Did they have them in the past?
They have them now. They have had them since our report and our implementation of them since.
So in the past, they did not have navigators?
That is correct to my understanding.
And when did they start?
After the first cancer report, which was in 2023, and when we received that and implemented the corrective actions or the recommendations.
So the first of the year in 2023?
I will have to go back
Okay.
and get that to
I'm
you.
just trying to get a
if you'd like
timeline.
me to, yes.
Okay.
It was as we were working through the implementation and looking at the deficiency identified by the OIG and what we found in our visits. And I also want to say that on top of those navigators, to make sure that those veterans have come somewhat of a concierge process to make sure that they get to all the aspects of this treatment that they need. We also have established the tumor board, as the OIG mentioned, that all of our facilities have. It's a multidisciplinary team of clinicians who come together and look at all new and existing cancer diagnoses to ensure that the veteran is getting the best treatment therapy or regime that is available. And we have also made sure and gone back and looked at the processes at Hampton. And when we look at one area we see failure, we look across the 6 other facilities as well to make sure that timely test results are being the notification of those test results are being done in a timely manner.
May I ask, prior to the report coming out, would you think that VISN's approach was more reactive or proactive? And is it proactive or reactive now? And do you have the data that you are talking about that you review? Is that in real time? Or exactly how is that process in place as far as something comes to you? Are you doing it monthly or in real time? Are you approaching it? But the reactive and the proactive question is one of my important ones.
Yeah, I would say that since my arrival, the VISN has become much more proactive in our stance and our engagement. We have real-time data that we receive and discuss at each of our daily huddles.
An example of the real-time data.
Example of the real-time data are reports from our patient safety office, which review all the patient safety reports that come in from every facility the day prior. They also include reports from our police services, so we understand what's happening. Any issue briefs that have been sent forward from occurrences that may have gone awry.
Okay, thank you.
As well as data. We have a lot of data points.
Thank you,
Yes,
Mr. Cruz. Dr. Baptiste, do you agree with Mr. Cruz's point that VISN outreach has been proactive?
I can't speak to what the VISN is currently doing, but again, given we had multiple reports over a several-year period of time, we would hope that the VISN be more proactive in their role earlier on in the process, regarding aspects of the cancer care program, such as the tumor board, cancer care committee that you just alluded to. These are fundamental aspects of a cancer care program, and these should have been in place at the facility. Our review identified those areas that were lacking. Certainly glad to know that the facilities put those into place, but those are critical aspects for a facility to have.
And then, if I could, that proactive and reactive, prior to Mr. Cruz coming there, in your assessment, was the organization proactive or reactive, and now, currently, what do you feel the status is? Or in the past?
Right.
You've answered the question.
I believe Mr. Cruz said he came to the VISN in 2021. So our most recent reports that we've been referring to were published in 2022, 23, 24. The reviews would have started in 2021, so I can't speak to the.
And then one other question.
Before
The real-time data that is available, is that something that you've identified as a weakness, making sure that they have real-time data?
One weakness that we did identify was that staff repeatedly were not entering those patient safety reports. So while it's great that the VISN and the facility might be reviewing patient safety reports, if they're not entered by staff, then they wouldn't have anything to review. So, it requires constant vigilance and attention to this issue by facility leadership, VISN leadership, to encourage staff to enter patient safety reports. It's really a responsibility of everyone to report incidents of patient safety.
Thank you. With that, I yield back.
Thank you, Ranking Member Mervan. The chair now recognizes Mr. Rosendale for 5 minutes.
Thank you, Chairwoman Kiggins, for holding this hearing today. The veterans in your district deserve better than the issues raised by the 3 OIG reports, and I'm glad we're trying to get to the bottom of it. We experienced a similar situation at Fort Harrison in Montana, and thankfully we've made major changes and are on our way to rebuilding both the trust and the morale of the veterans who visit that facility and the staff themselves. I think that we need to make sure that as we look forward, though, that anyone who is removed from one of these facilities isn't just hidden in another facility. That is critically important. In your testimony, Dr. Baptiste, you alluded that when a whistleblower reports a problem to OIG, the facility leadership is typically already working to correct the issue. However, this was not the case in Hampton, Virginia. As a matter of fact, you referenced 3 reports over 3 years. Can you please elaborate on this for the committee?
So often when we go into a facility, we do find that the facility leadership is already aware and is working on it, as you said. But in the Hampton reports, in a couple of them, facility staff weren't aware because, or facility leadership was not aware because staff hadn't entered those patient safety reports. In another instance, the quality manager was not initiating peer reviews in a timely fashion. And in the third case, while the facility had started some of those quality reviews of the surgeon's care, the reviews weren't being conducted correctly. So they're really ineffective. They're not
So to go to Representative Mervan's questions, they absolutely were being reactive, not proactive. I mean, if you're not even aware of it. You testified that leaders did not create an environment that fostered individual responsibility and continuous improvement. Please elaborate on some of the failures by leadership and the steps the new leadership can take to foster individual responsibility better.
So leaders need to create a culture of safety and accountability throughout their organization. Leaders need to make clear expectations, roles, and responsibilities of staff, hold that staff accountable, empower them to execute their roles, and so these are some of the steps that leadership can take.
Very good, thank you. Dr. Baptiste, to try and lay out for the general public exactly what was identified and what kind of progress may or may not be taken, your testimony highlights the passive nature of VISN oversight. What specific actions can VISN leaders take to shift from passive to proactive oversight, particularly when addressing patient safety and quality of care issues?
So as you alluded to, our reports in Fort Harrison, as well as at the Aurora, Colorado facility, illustrate what can happen when a VISN is passive in their role. We heard in interviews with facility or VISN leadership that they were either not aware that there were problems at the facility or that they hadn't intervened because the facility didn't ask them for help. So we would expect that the VISN take a more proactive role in identifying problems, being aware of problems, and supporting facility leaders and staff to make necessary changes.
So I would say that what we're talking about then is making sure that number one, these reports are being created, and number two, somebody's reviewing them.
Correct.
Thank you. Thank you. Dr. Baptiste, the OIG noted that there was a lack of responsiveness to concerns raised by facility employees. What improvements can be made to ensure visit leaders are fostering an environment where whistleblower concerns are taken seriously and acted upon promptly?
Yeah, it'll take time for facility leadership, VISN leadership to regain the trust of facility staff, but ensuring a culture of safety, encouraging staff to, again, take responsibility for their roles is, what the new leadership is going to have to take on.
Very good. I visited several coal mines over my time with serving here in Congress and even in the state legislature, and they're dangerous work sites. There's a lot of very heavy equipment around, and everyone on that work site is directed to let their supervisor know as soon as they see an issue, and that promotes that culture. Dr. Baptiste, in the 3 reports that OIG has conducted on Hampton, Virginia, how many recommendations have been issued?
So in the first 2 reports, we had 7 recommendations in each of those. In the 3rd report, there are 12 recommendations.
Are the 12 different, or do they include some of the ones that have already been made?
All the recommendations, I think, are slightly different, but there are some similar themes in terms of patient safety reporting. That was a recurrent theme in our findings, lack of patient safety reporting, and ensuring that some of these quality review processes were either conducted in the first place or conducted correctly, is in the example of the last report.
Very good. And Madam Chair, if I could, just one more question to wrap up. How many of those recommendations, Dr. Baptiste, have been implemented, and how many of those recommendations are still outstanding?
So from all the recommendations from the first report are closed. From the second report, 2 recommendations are open. One of the recommendations is regarding the primary care team and care coordination activities. The other is regarding asking that the facility review the root cause analysis that they completed to ensure that they identified all of the concerns. The facility has been responsive. To those recommendations, we have communication every 3 months regarding the open recommendations, and we do expect that the facility will be able to close those. Our 3rd report was issued in the end of July, and so all those recommendations are open. We expect to have the first follow-up kind of communication with the facility in about a month.
Very
How
good.
they're doing.
Thank you very much, Dr. Baptiste. Madam Chair, I yield back.
Thank you, Mr. Rosendale. The chair now recognizes Congressman Scott for 5 minutes.
Thank you. Thank you, Madam Chair, and thank you for the invitation. Dr. Baptiste, healthcare, quality healthcare, you kind of know it when you see it. Are there objective standards by which you can measure the quality, or is it necessarily subjective?
There are quite a number of objective standards one can use to assess quality, and I believe VA has quite a number of metrics that they use to assess the quality of care.
Thank you. Mr. Cruz, Dr. Baptiste said just about all of the recommendations, past recommendations, have been implemented, a couple of open ones, and then a new report. There are a list of new recommendations. Is there any reason to believe that all of these recommendations, can we assume that all of these recommendations will be implemented?
Yes, sir. We're actively working those. We are in communication with the OIG, and our teams are meeting biweekly with the facility team.
I talked to you a little earlier. I'm sorry.
And if I may, your question as well, I'd like to just make a comment. I'm very proud of the Hampton team. It takes very dedicated clinical staff to make sure that we provide the highest quality of care. And in your question about measuring quality, the Hampton VA team, with some issues that we've spoken about today in these reports, has maintained for the past 2 years 4-star quality in the CMS rankings, star ratings. And that actually, when we look, is better than 70% of the private sector facilities across the nation.
Well, thank you. In terms of attracting medical professionals, do you have the budget authority to hire fully qualified professionals?
So as we mentioned, I think it's known that the Hampton market is a notoriously difficult market to hire some clinicians, many different types, laboratory as well as physicians and so forth. We do have some authorities, but we struggle with hiring because of some pay authorities which limit how much we can pay providers, physicians. We struggle to make sure to attract those high-quality candidates.
Do you need additional budget authority?
Probably should, I feel that we do need official authority. And I know, speaking with the Secretary about some legislation that have been considered in the past, I'm hoping to see that passed to enable us to be more effective in competing with the private sector.
Thank you. The facility at Hampton is over 150 years old. The age of the facility, does that cause challenges in providing quality of care?
Yes, sir. Even though it is a beautiful facility right there on the water, as a Navy guy, I loved going out there and spending time out there as an aviation guy, so on carriers. It does. With the old infrastructure and the challenges we're having with keeping up with that infrastructure, especially there in that environment, the coastal environment, we experience a large number, and I'd have to get back to you on this, but a large number of infrastructure failures relating to air handling units and our also water management, chiller systems, and steam systems. And so that has been very difficult to keep the pace up, and be able to do that non-recurring maintenance that we need to do at our facilities.
Well, that's obviously a budget issue. Have you developed a budget so that we can deal with those?
We have submitted that through my leadership to make sure that we can address those critical needs that we have not only at Hampton but at all of our facilities.
And also capacity. The veteran population in Hampton Roads is growing. Is the hospital able to absorb the demands of a growing veteran population?
So thank you for that question. With the implementation of the PACT Act, that Hampton has been growing significantly. As a matter of fact, it's the highest growing, at the top of the highest growing VA facilities across the nation. And so we are working with everything we can to bring online new square footage. We expect to, in the spring of '25, to open the Chesapeake or Battle Creek Healthcare Center, a 200,000 square foot multi-specialty facility. But I'm also very proud of the work we have done in Vision 6, working with our DoD partners and DHA. We've been able to bring on a 25,000 square foot ambulatory outpatient clinic in the Langley Hospital, and are working right now with Portsmouth VA Hospital to share services where they need some services from us across, and which we can provide across the VISN, but also being able to utilize and share services with them.
And a final question, what efforts are made to ensure good communications with the workforce at Hampton?
I would like, if I can, to pass that on to Mr. Dannenberg to speak to that.
So thank you for your question in regards to having improved communication from the frontline staff. And I will say, as my focus as the acting medical center director, having a culture of safety and having our employees and team members feel as though that they can be supported and bring forth any issue impacting their ability to do their work to their fullest. Just over this past month, excuse me, I've been in the role for just over 7 weeks, but I have implemented a daily management system which allows any individual within the organization to be able to escalate and identify and report any issue impacting their ability to do their job. And that is a part of a tiered escalation process. And at each level in that organizational structure, there's the opportunity to problem solve at whatever level can create that solution, all the way up to the executive leadership team. So having real-time daily communication about issues impacting the workforce is something that is readily communicated on a daily basis. Earlier, it was spoken about the ability of our staff and team members to have knowledge about being able to report patient safety concerns, and along with that goes disruptive behavior reports. So within the first few weeks of being the acting medical center director, I started having weekly town halls every Friday, and one of those town halls specifically took time out and obligated a presentation specifically to how to file a joint patient safety report or a disruptive behavior reporting, so that if any individual has a concern, that they can implement and report that so that that can be reviewed for further evaluation and action as appropriate.
And thank you, Madam Chair, and I appreciate the invitation.
Thank you, Congressman Scott. And I have a few more questions, and I believe our ranking member does as well. Ms. Baptiste, just to revisit a statement you made, you had said that employees were not entering the patient safety reports. What would you think would be the reason why they weren't doing this?
Two reasons. One, they either didn't know how to do it, and two, they didn't feel empowered or safe to do it. We heard from some staff that they feared retaliation if they entered patient safety reports.
Thank you, and I would agree with that. We've had whistleblowers continue to reach out to my office, from janitors to surgeons, again, around 25, just saying they were fearful they'd be retaliated against for doing the right thing and exposing clinical care and facility cleanliness concerns. So, Mr. Dannenberg, I know we have sat down and welcome. We're very excited to have you at the Hampton VA. And could you just go a little more detail about what you're doing just to ensure Hampton employees don't feel like they will be retaliated against?
Sure. So I will say my priority focus is creating an organization of high reliability. And what that means is for any employee to have the ability to share what's going well, but also what is not going well. So having regular open meetings where if people want to reach out and talk to me as the acting medical center director, I'm more than happy to make time and meet with them. But really having implemented a structure across the organization that allows the supervisor to be able to support the work that's happening within that specific work group and support the work that's being done. There are two foundational principles that I operate from. One is respect for people and respect for the work that is being done. And making sure that I train all supervisors with that philosophy and that concept. Culture change does take time, but by role modeling that behavior and being out and about in the facility and talking with our frontline employees all the way up to the executive leadership team and being present is my main focus in moving forward.
We know you have a lot of experience at turning VA facilities who have had some challenges around into top-notch care facilities, so we're definitely excited to have you and to continue to see change at that facility. What would you say are the top 3 issues that you've prioritized, just being on the ground for 7 weeks, that you are starting to work through in order to make this transition?
Sure. So my top 3 priorities, one is the implementation of the daily management system, which I spoke to, which is already implemented. 2 is working with the executive leadership team that is currently in place, coaching them on the high reliability practices, role modeling, even practicing conversations, and then being open is the 3rd priority, and being out there working with the frontline staff and taking their feedback and being able to implement that and implement changes for the better for the good of the organization and the employees.
Have you seen any change, I guess an increase in the number of patient safety reports that are being filed since you've been on the ground and implemented some of these changes?
So I can't speak to the volume of the JPSRs prior to my arrival, but what I will say is we have incorporated a daily review of the joint patient safety reports that are submitted at each of our daily morning huddles, and that list is also reviewed by the executive leadership team along with the patient safety officers to see if there are any trends that need further evaluation and action.
Okay, and then just switching gears and question, what are you doing to solve the provider shortage problem at Hampton, specifically in anesthesiology?
So that is a great question, and I can say that I've had recent conversations with my boss, Mr. Paul Cruz, is our network director, and being able to utilize the pay authorities that are available to us. We also have access to the national contract for scarce medical professionals and have been able to utilize that for our anesthesiologist shortage, which was mentioned earlier. And then just being out and working with our DoD partners. Again, our Hampton Roads area is a highly populated area when it comes to the veteran demographic. And when we have active duty providers or healthcare professionals, when they leave active duty, working with the VA and continuing their federal service is a great transition, and being able to strengthen those partnerships to make that happen.
And I'm sure you're also looking at nurse anesthetists and having them fill provider shortages, which is as a nurse practitioner, again, just putting our plug out there we're a great source of addition to care where there are shortages. Mr. Cruz, another question for you. How are you going to make sure the Vision 6 has the proper oversight of Hampton moving forward?
Thank you very much for that question. Because it is really deep in my soul to make sure that we stay proactive, and that we engage. That is what I've been doing, is to make sure that we're reaching out and staying engaged with each of our facilities. And we will continue to focus on our high reliability objectives, making sure that our facility leaders understand the importance of being sensitive to what's happening in the operations, not simplifying issues, and making sure that they fully look at those and that they have deference to expertise.
And then a little bit of a different question, but when the previous Hampton director was reassigned to a new position, why did it take so long to make that decision to reassign that provider?
So when issues were initially identified and we started working through things, my goal initially with a leader is to coach them and to direct them to correct processes and make sure that they adapt to the expectations. As we move forward through that, we began a process to do a review of the leadership team. Once now is actually at the OAWP, where I hope to see conclusion of that here very soon.
We do as well. And then, Mr. Kotler, I know that we haven't had as many questions for you, but wanted to give you an opportunity just to describe what your role was in the OIG report and any recommendations you might have.
Sure. So my role is very different from the OIG's. Our office investigates very specific, sort of narrowly scoped allegations from whistleblowers. We've done 4 over the last 2 years at Hampton.
Did you have anything to add as far as recommendation goes?
We had
going
a
forward?
total of 13 recommendations over the course of those 4 investigations. 11 remain open. However, 8 of those are from a single report that was just published this past summer, and so we have not even received a first 90-day update on that action plan yet.
So you will be staying on top of the corrective action and
We follow
following
those
up with the
action
timeline.
plans until they are complete.
Thank you. And so if I could just ask your office and Mr. Dannenberg as well, just to keep, especially myself and Congressman Scott, who represents that district, and my district is right next door, home to many of the veterans who receive care there, just to keep us updated when all the recommendations are implemented. I know that we've received a lot of media coverage on this topic, that our veterans do care and they deserve the best treatment that we can give them. So I thank you for that, and I look forward to keeping in touch. And with that, I will yield to Ranking Member Mervan.
Thank you, Chairwoman. Dr. Batiste, in 2019, the report, the GAO recommended that the VA develop a policy directive to define these VISN roles and responsibilities. This policy was recently released, but only discussed the role of the VISN director, but not other key positions like that of the chief medical officer or quality management officer. Is this directive adequately scoped to help define these roles and better support the facility and VISN interactions?
The directive that was released, I don't think is what we expected to see in terms of outlining the roles and responsibilities of multiple leaders and staff at the VISN level. As you pointed out, that directive only includes roles and responsibilities for the director, the VISN director.
Dr. Kotler, thank you for being here today. I appreciate the work that the Office of the Medical Inspector has done at the Hampton and in the past 2 years. How does the OMI conduct virtually investigations, and how do you determine when a virtual or in-person investigation is needed?
So we started doing virtual investigations during the pandemic when we couldn't travel. Since that time, we have probably gone back to, I'd say, 70 to 80% of our investigations are in person and on site. anything that resolves around the physical plant of the hospital, the operating rooms, sterile processing, mental health, we go on site. We want to lay our eyes on those, on the facilities. Virtual investigations at this point are really limited to allegations involving where we don't need to be on site, where it would be, say, consult reviews, chart reviews, where we can conduct interviews online.
And then, Dr. Batiste, I think it's clear that all of us here that at the Hampton, there's a need for stable and consistent leadership. Dr. Batiste, can you speak to the role of interim leadership and how these leaders can bring about positive change and the impacts to Hampton employees and patients?
Sure, it certainly is challenging for interim or acting leadership, but it sounds like from what Mr. Dannenberg said, they may be on the correct path. It's really critical that leaders are available, visible, that they set clear roles and responsibilities, they hold staff accountable, ensure that that they prioritize a culture of patient safety at their facility and learn from mistakes.
Okay. Mr. Dannenberg, when my staff visited in August, we heard that the Hampton is working on addressing the growing veteran population by opening several more sites in the area within the next year. Have you assessed what the staffing need is to make these facilities fully operational? If so, what does that look like?
Yes, so our veteran population existing on the southern side of our catchment area makes up about 60% of our veteran population. And we spoke a little bit earlier about the HCC in Battlefield in Chesapeake, and that is a 200,000 square foot facility that is going to offer a number of services from primary care, mental health, eye imaging lab, a few other specialty services to name a few. And when we look at our projected growth, we are one of, if not the top growing facility in the country. So there are a number of opportunities for us to continue to grow, but also to have a plan in place for increased clinic space. HCC1, the Battlefield Outpatient Clinic, is the first major step. And we do have a second project, second HCC large, 200,000 square footish facility that is also in line for future construction, as well as a 27,000 square foot additional outpatient clinic as well that will be added to our capital asset portfolio.
So one of the challenges that we face is staffing. And as this facility grows, staffing will grow. What is your approach towards being able to facilitate the facility with staff?
Yeah, great question. That is a multifaceted issue. One is creating a culture where our employees feel valued, so you have the retention component of keeping those highly valued team members. The other is working within the span of control that I have as the acting medical center director to support the pay authorities that allow us to recruit top talent. And the other part is the actual active recruitment, whether that be through USA Jobs, word of mouth, and just actively recruiting through professional journals or other avenues available to us to ensure that we're getting the maximum reach for individuals who may be interested in joining the VA healthcare system.
Okay. And then one last question, Mr. Cruz. Last week, my staff visited the Bronx VA and learned about the facility's telehealth support services that it provides to VISN 6. To me, this exemplifies the work VA should be doing to support staffing shortages in other geographical areas when they arise. How can VISNs work together to provide staffing, resources, and capacity support to facilities like Hampton?
I really do appreciate you bringing that up. This is the great thing about getting together as leaders, as network directors, and being able to speak with each other. I had the opportunity to speak with my colleague in New York, Dr. McInerney, the VISN director, who was complaining about her veteran population declining while I was complaining about my veteran population was increasing significantly. We were able to facilitate a deal where using telehealth modality, we now provide over 6,000 veteran enrollees in our Fayetteville market at the present time access to physicians in the Bronx. It has been a super project, and actually looking at increasing that and extending that. Right now, just speaking with them last week, with the New York last week, we're looking at adding more, and we are actually looking at Hampton for adding those and looking at different specialties, possibly besides primary care, where we can add that service.
Okay. With that, I yield back. Thank you, sir.
Thank you, Ranking Member Mervan. I want to thank the witnesses for coming today. I appreciate your candor and willingness to participate. Ranking Member Mervan, do you have any closing remarks? Okay, thank you very much. And just thank you all again for being here. For far too long, the Hampton VA was led by ineffective leadership that Vision 6 did not recognize, but now does. So I hope the Hampton VA, with its new leadership, can now turn the page. However, this can only be done if the OIG's recommendations are fully implemented and facility leadership adequately addresses whistleblower concerns. I look forward to further engaging with the VA to ensure the appropriate changes are made so veterans know they will receive quality care at the Hampton VA Medical Facility. I ask unanimous consent that all members shall have 5 legislative days in which to revise and extend their remarks and include any extraneous material. Hearing no objections, so ordered, and the hearing is now adjourned.
Yeah.